Hi, my name is Deborah Sindewald. The title of my research is Cardiac Rehabilitation, Impact on Psychobehavioral Symptoms, Inflammation, Cardiac Health, and Quality of Life. Guided by psychoneuroimmunology theory, the purpose of this study was to examine psychobehavioral symptoms in IL-6 with respect to cardiac health and quality of life in cardiac patients over a 12-week rehab program. Cardiac events result in psychological stress, depressive mood, fatigue, and sleep disturbance, which jeopardize cardiac health. To promote recovery, cardiac rehab programs provide monitored exercise and health education. Whether rehabilitation reduces psychobehavioral symptoms or stress-related inflammation remains unclear. Inflammatory mediators such as IL-6 contribute to cardiovascular disease and engender psychobehavioral symptoms. This is the model for the current study. The purpose of the study is to investigate changes in the relationship among psychobehavioral symptoms, the inflammatory cytokine IL-6, and cortisol with respect to the response to cardiac rehabilitation. Also to determine predictors such as perceived stress, sleep quality, depressive symptoms, and inflammatory markers of cardiac health indices and quality of life. My study was a prospective longitudinal design. Participants were evaluated at the start of the program, the middle, and the end of the 12 weeks of rehab. 40 of the 58 participants I recruited completed all of the time points. At each time point, participants completed questionnaires assessing depressive mood, sleep disturbance, fatigue, perceived stress and quality of life, and also social support. IL-6 blood samples were collected for IL-6 measurement to measure inflammation in the bloodstream, and I also collected saliva samples for diurnal cortisol levels. I gleaned cardiac health data from the charts, including HDL and LDL levels, metabolic equivalent of TAS, fasting blood sugar, and heart rate and blood pressure at each time point. Data were analyzed using ANOVA, Pearson-Zara, and multi-level linear modeling. These two charts show the sample characteristics, including demographics and cardiac risk factors. This chart shows cardiometabolic changes over time. This shows psychobehavioral variables and change over time. And here we see association between psychological variables and quality of life. You can see that most of these psychobehavioral symptoms correlated strongly with quality of life and health functioning quality of life. Results of my study. Although perceived stress decreased significantly over the course of cardiac rehab, 35% of participants continued to report increased stress at T3. Depressive mood did not change over rehab, with 22% scoring above the cut score for depressive risk throughout rehab. Fatigue decreased significantly over time. However, those with greater fatigue had worse cardiac health. Sleep quality improved significantly over time, yet 42% of participants reported sleep disturbance. Still, it's T3. Both total quality of life and health functioning subscale quality of life significantly improved by the end of cardiac rehab, and both quality of life and health functioning subscale were negatively correlated with depressive mood, disturbed sleep, fatigue, and perceived stress, but positively correlated with social support. Although IL-6 did not change over time, participants with higher IL-6 levels had lower MET levels, lower health functioning subscale, and greater LDL levels. In conclusion, exercise addresses only part of the healing equation for cardiovascular patients. The exercise and social support of cardiac rehabilitation did show some positive outcomes for patients who completed cardiac rehabilitation. There's a need to teach patients how to engage the parasympathetic nervous system to help in the regulation of cortisol in their HPA axis and to lower stress and reduce fatigue and sleep disturbance. Implications for future study would be to assess the impact of teaching sleep hygiene strategies and ways of reducing fatigue. Also to evaluate mindfulness, meditation, deep breathing exercises, and possibly yoga, and to evaluate strategies to increase participation and attendance at cardiac rehabilitation. Thank you for attending my presentation.